The heart is a strong muscular organ which contracts in order to deliver blood around the body. Electrical activity starts in the top right chamber of the heart and it propagates down through the muscle in order to give us what we call the pulse. Your pulse is the number of beats that the heart contracts per minute, and at rest this is normally between 60 to 100 beats per minute. As we exercise or if we become anxious, this increases in rate above 100 beats per minute, and this is a normal condition. Sometimes short circuits can form in the heart. One of these is very common and is an irregular heartbeat called atrial fibrillation. This originates from the top left chamber of the heart, in which there are multiple circuits firing off very rapidly. The rate can be up to 300 beats per minute. Thankfully, the way the heart was created, there is a circuit breaker within the heart which cuts out a lot of these beats. If this didn't exist, we would drop dead from this condition. The circuit breaker results in a pulse which is approximately 100 to 150 beats per minute, while still fast, is still compatible with life. It does, however, lead to very disorganized activity within the top chambers of the heart, and clots can form inside the heart, and this can result in strokes. It is therefore very important that this condition is diagnosed and treated appropriately. If appropriate treatment is instigated, then the quality of life and longevity of the individual can be almost normal. The most common causes of atrial fibrillation are high blood pressure, also known as hypertension. This can be treated with medications. Valvular heart disease, in which the valves which open and close in the heart either become narrow or become too floppy, affecting the blood flow and therefore the pressure within the heart. Heart artery disease, also known as coronary artery disease, in which we get narrowing of the blood vessels within the heart artery, which can result in angina or heart attacks. Obesity, in which an individual's body mass index is elevated, and this puts excessive pressure on the heart. Obstructive sleep apnea, in which there is pauses in respiration during sleep, and this can put pressure in the top left chamber of the heart. And thyroid dysfunction, in which the thyroid, which is a gland in the neck which controls metabolism, can either be overactive or underactive. In general, the treatment of atrial fibrillation is divided into thinning the blood down to reduce the risk of stroke, drugs which may control the heart rate or try and maintain normal rhythm, and catheter ablation, in which miniature wires are positioned inside the heart in order to target the short circuits, eliminate them, and improve the overall quality of life. The most common blood thinners are apixaban, which is taken twice a day, edoxaban, which is taken once a day, dabigatran, which is taken twice a day, and Xarelto, which is taken once a day. There are various pros and cons for each of these drugs, and the decision on which drug should be started, if any, is a joint decision between yourself and your physician. Although there are several drugs which may control atrial fibrillation, these often provide insufficient control of symptoms and may lead to some side effects. In these cases, it is often recommended to have a catheter ablation. In a catheter ablation, you're put off to sleep, generally under anaesthesia, or else administered sedation in some centres. The heart is checked to ensure there is no clot within the heart, and this can be performed either using a transesophageal echocardiogram, in which a probe is positioned down the throat to look inside the heart, or a CT scan. Your blood thinners may be held before the procedure, and this depends on the physician, who will discuss this in more detail. Wires are positioned microscopically from the groin, from the femoral vein, all the way up into the heart. A tiny hole is made from the right side of the heart to the left side of the heart. This is an area of the heart where a hole or thin tissue normally exists, and in general this seals off after the procedure. A GPS system is used in order to look inside your heart, and multiple points are collected inside the heart in order to understand the electrical circuits within the top left chamber and occasionally top right chamber of your heart. After this data has been collected, a very sophisticated heart map is produced with multiple electrical points, and a special wire is used to deliver energy to the tissue. The object of this wire is to isolate off the short circuits within your heart, and the procedure ends as soon as these have been targeted. This procedure can take anywhere from 1 to 4 hours, and occasionally may be longer in particularly complex situations. Following the procedure, you remain in the hospital and are monitored. Following discharge, specific advice will be administered. However, there is limited activity in order to allow the groin to heal. It is important that the blood thinner is recommenced after the procedure, and this prevents clots and strokes from forming. So what are the pros and the cons of a catheter ablation for this irregular heartbeat? The overall pros are that this can have a significant impact on symptoms, a reduced need for medication, and all of the side effects that go with the medication, as well as an improved overall quality of life. Importantly, at this moment in time, it does not eliminate the need for a blood thinner, and the decision regarding long-term management with the blood thinner is made 3 months after the procedure, depending on your overall risks. The cons are that in order to achieve success, more than one procedure may be required. This is because areas which are targeted sometimes can regrow, and therefore they need to be retargeted again. There are also complications associated with this procedure. In general, the complications are the potential risk of clots and strokes, which is quoted at a risk of around about 1%. It is therefore important that you're on a blood thinner both before and after this procedure in order to minimize this risk, and you are administered a drug called heparin during the procedure to minimize this further. The flip side of heparin is that you can get bruising or bleeding around the groin site, although in general this is relatively minimal and does not require any significant management other than conservative monitoring. Other potential serious risks are the risks of burning a hole through the heart muscle wall when delivering the energy. In general, if this occurs, this can be managed by inserting a drain around the heart, and the operator and staff in the room are generally monitoring for this continually. Less common risks are the risks of damaging the veins and arteries around the heart, as well as the esophagus. Although mild inflammation of the esophagus is not uncommon, serious complications related to this are thankfully rare. In general, it is possible that you can still experience symptoms which feel very like atrial fibrillation, and may indeed be due to atrial fibrillation after the procedure, although if the procedure has been successful, these should settle within the first 3 months.